Ooh, look at my hair. How come it didn't let you in? Hey, I don't know why it's not letting you in. I don't know. Hello, how you doing?
Hi. Ow,
How are you doing? I don't know why I have to readjust my Zoom on this computer. It's got y'all sitting here in the waiting room.
ow.
Mm. How are you doing?
I'm good.
More people coming. Hello, what you doing, Sandra?
Nothing with this one.
Hey, Alicia, what's for dinner?
Leftover cabbage, meatloaf,
Oh,
rice, and cornbread.
girl, I'll come to your house. Cabbage and cornbread.
Oh yeah.
No.
Hey, Stacy, how are you doing? Hey, Stacy. I don't know why this thing is so different on this computer. Hey, oh, Antonisha in the car. Hello, Alexandria.
Hello.
How are you doing?
Good. How are you?
Very good. I guess we're gonna give him a couple minutes. It seems like y'all, I have to when I get ready to when I come out of this, I'm gonna have to readjust my Zoom so that you guys can automatically just come into the room. I don't have to admit you from the waiting. How was the homework? This week's homework? Anybody? How was the homework this week?
The homework.
Yes. Last week's homework, I guess I should say.
It was good for me.
A lot better than the week before, huh?
Oh my God. Yes.
Well,
Did you ever send out all the grades for the quiz or the test we took?
you didn't get your grade?
No.
Okay. I don't know. I'm gonna have to look at it and see. I'll go through tomorrow. I'll have time tomorrow. I had labs today, so I didn't get to go through, but I will tomorrow.
Okay.
Yeah, I like that better. All right. All right. So who else is here? Hey, Jocelyn, how you doing?
Hi,
I'm
Miss
good. And you?
Hi, everybody.
Hey, Denise.
Hi.
I had a hard day today.
Uh-oh, watch out. What happened?
Woo! At work.
Oh, okay.
I start at 5 in the morning and I finish up at 4.
Woo. For the
Wow.
afternoon?
Huh?
For the afternoon?
Yeah.
Okay.
And then I have to do some groceries and cook and kids. But I'm here.
What's for dinner?
I cooked some beans and rice and some chicken from Walmart.
That's good.
That's a lifesaver.
I my Sunday dinner, that's what I used to be with Walmart chicken, public chicken. That's what it used to be. Public chicken and some Hawaiian rolls.
Oh. So, Miss DeBerry, I want to be clear. To this week, work will be 6, 11, 13, 15, and 16, the chapters.
Yeah, you guys already did 11, right?
Uh-huh.
So 6, 13, 15, and 16. Yeah.
Perfect. Okay. Okay. Thank you. I'm gonna mute myself, okay?
Okay, that's fine. That's fine. All right. So I don't know. Uh-oh.
Someone's dog just got ran over.
What?
Yeah, that's what she said.
Uh-oh. Where did that go?
She said my dog was just ran over by a truck. We're talking to the vet, but can you email it to me and I will watch it? I can show proof of the vet stuff.
Absolutely. Absolutely. Go ahead. Go ahead. I'm so sorry. It's awful. All right. So I did want to talk to you guys about lab days are changing. Y'all know that lab days are changing. Well, you already know, of course. We're on Zoom today instead of being in the lab. So I'll be looking for you guys tomorrow from 6 to 8. But this week is going to be the last short week. They're pushing me because they want you guys to be here for 4 hours. So I think it's 4 hours, but at least 6 to 11. So plan on that next week. I know that's going to be hard, Denise. You're going to be asleep. That's going to be hard. But we're going to do it. We're going to persevere. All right. And actually, that last week, next week is going to be your last week of this module, I believe. So we just want to get through with it and, get you guys going so that you can do some other things. We didn't really, I don't know, other than washing your hands and vital signs, they haven't really done any of the other skills that they generally do on this module. I really wanted to try to see about getting you guys into that SIMS charting so that we can get some of that stuff done. I don't know, Denise, have you ever done SIMS charting before? Have you ever?
No. If I see it by name now at this time of the day, I don't know. But if you show me how to do it, yeah, I think I get it.
Okay, all right. So what it is that nowadays, most often charting is done electronic. You do electronic charting, and very few people use paper charting anymore. By the way, if you do have to do any kind of documentation by paper, you need to make sure that you have a black pen, not orange, not red, not yellow, not green, not pink, not sparkles, not sky blue, but a black, just a regular black ink pen, black ink. It doesn't really matter what kind of pen that you have. Like say if you use a fine point or if you use a gel, I guess it's up to you. It depends on the organization, but definitely when you do start working, you need to make sure that you have a good collection of some black pens, and you can get some pens from the dollar store, wherever. You don't have to spend a whole lot of money to get them. Or if you're able to go during the time when school is starting, you can get some pretty quickly or for cheap. Okay, just food for thought. Also, on your outline, it was talking about doing a typing test. So I want you guys to make sure, and I want to see that you do it. I have a thing here. Let's see. Where am I at? Trying to share my screen. Okay, so there is a website, and it is, what is it? Typing. It's a typing test. Typing learntotype.com. Anybody ever been on this website before?
Mm,
Do you guys have access to a keyboard,
F.
computer?
F.
You have, okay. You have access to a keyboard or computer? If you don't, most likely what we're going to do, what I want to do is tomorrow, Tuesday, I'm trying to see about getting us into the computer lab so that we can get on there and see what we can do about some typing, build up y'all skills. Everybody should be pretty close to being done with their vital signs if they're not already done. But here, if you go on this website, it's learntotype.com, and it says you can do a typing test. And I can't show y'all my typing test because that ain't none of y'all business. Okay. But if you go on here, learntotype.com, I'm trying to see where it shows it at. No. There is a link that it'll take you to. Yeah, here it is. Typing speed test. So the first thing that you want to do is a typing speed test. And it can kind of tell you where you are at as far as typing is concerned. If you're very good, if you're very proficient, if you're not so good, whatever it is, what level you are. And it also gives you some information on how you can sign up for free lessons, all kinds of things like that. So I want you guys to, you can do practice at home if you have a keyboard. I want you to go on this website as part of one of your assignments. And I don't care what your results are. I'm not worried about that right now. I just want you to go on that site and to do the test that they give you. And just, if you can screenshot it or whatever it is that you need to do so that you can send your results to me so we can see where you're at, okay? All right, everybody, good?
All right.
Good, good, okay. So we're gonna do that. Next thing, in your outline, it was talking about, another thing it was talking about is, of course, your health, we talked about that, the electronic health record, or the EHR, and its benefit to hospital and patients. So there is a video that's on here. You guys need to watch that video. It is going to help you to answer the questions for your SurveyMonkey if you didn't already look at that. It also has that learntotype.com testing on there. I need that back by Wednesday. I should ask God to have it back by tomorrow.
Okay. You need the results back?
Yes. Yes.
Okay.
And then tomorrow, like I said, when we get to the lab, we're going to do some more practicing and typing. I would like for you to bring your assessment. Remember when you guys came, was it when you came to the lab? I think it was. We talked about taking an assessment on a patient and gathering information on that patient. Did any of you start that?
Yes, I finished it.
Okay,
Me too.
good.
I'm already done.
Good, good. Good. So you need to bring your information with you so that we can begin doing some documentation on that. There's a form here that I want you guys to look at. No, this is a lab slip. But we're going to look at some different forms of health assessment and the completion of some of those forms. And we are also going to, of course, you do your SurveyMonkey questions. And then your homeworks, if you can have those to me by Friday, that would be great. Have your homeworks to me by Friday. I will be putting in more grades for you. Your second week grades will be going in tomorrow. Also, I don't know if I mentioned it to you, but part of your grade is your participation. And participation is not just doing SurveyMonkey. SurveyMonkey is nice. That's great. That's good. It's going to pass you. But if you want that A grade, you got to be in my lab and you got to be on my Zoom. You have to be in my lab and on my Zoom. And I'll give you an A, 100% for your participation. If you are not in lab, then I'm not going to give you those 10 points for participation. I'll give you credit for actually doing the lab or coming. I'll give you credit for homework if you do your homework. But if you're not in lab, if you're not on Zoom, then you're not going to get 100% for your participation. I'm just saying. So it's not fair for other people to have to take away from their time and their family and whatever they're doing to be on, to be in the lab and to be on the Zoom. And then also, just to let you guys know that it is becoming mandatory that you come to class for labs twice a week for both of those sessions. And so if you have issue getting on campus for whatever reason, you need to let me know as soon as possible so that we can try to see what we can help you to work out, because you're not going to make it without it. They're not going to allow you to continue without coming on campus. So that's just some FYI stuff. Like I said here, in the workbook or student workbook, you're going to do, I know you guys already did chapter 11, so you don't have to worry about that, but chapter 6, chapter 13, chapter 15, and 16. And here it says you do pages 1, 2, and 3.
You're breaking up.
Oh, you can't hear me?
I can hear you.
Okay. So you're doing pages 1, 2, and 3 in the workbook. Chapter 6, 13, 15, 16. Okay. And then I think that just because we've had so much upheaval, so much going on this last module, I'm not going to worry about a project this time. I wanted to do that, the mock office visit, but I just don't think that we're gonna be able to get to it. And I don't want to do it sloppy. So the main thing that I want you guys to focus on is everybody getting here to the lab, everybody getting in on the Zoom, and also getting your assignments completed so we can get you some good grades as much as possible, okay? All right, so the first thing you talked about here as far as the working that you guys are, I'm sorry, our lecture for today is one of the things we wanted us to talk about was assisting in obstetrics and gynecology. And then I want to look at a female exam and also look at just a regular exam. So, yeah. So the pelvic exam, this one is a little silly, but it's okay.
Yeah, and then I'll meet you and then we'll do it together. Perfect. Hi, Abby. Hi, I'm Leslie, student here at the office. I'm going to get you ready for your pelvic exam. Am I ready? All right, let me make sure I have everything here. All right, I need some lubricating jelly. This will do. Perfect. All right.
I don't think so.
Specimen cup. This one. This is good. I need some gloves. Medium my size, I guess. Speculum. The light's already attached. Perfect. A cervical broom. Giant cotton swab. And some 2x2 gauze. Great. I think that does it. All right, so I think I have everything set up here.
So you guys, I hope you know that some of this is wrong. But I wanted you to see this so that you can have a general idea of what a pelvic exam looks like, what they're actually going to do during the exam. It's a little bit different looking from the outside.
Are we listening or are we watching a video?
Watching the video, can you see it?
No.
You can't see the video? Can y'all see the video?
I see it. Yes, I see it.
Me too.
Okay. I don't know, Alicia.
I can see it now.
Okay, good. Can you hear it?
That metal.
She already knows. Abby? Hi. I'm Amy. I'm the PA here. I'm gonna take care of you today. So we're gonna do your pelvic exam? Yes. Okay, so first I'm gonna get the stirrups out so we can get you all set up. And it looks like Leslie already went ahead and set everything. Leslie?
Uh-oh.
It's like horrible connection.
Oh, no.
Don, have you seen my jelly?
Oh, no, I see a thing. Oh, I forgot to ask if she liked grape or strawberry.
No.
Sorry about this, Abby. Give me just a second. Leslie, let's go over what we need to do our pelvic exam. So first of all, we need some lubricating jelly, not grape jelly. We'll put this over here. We'll go ahead and get some KY water-soluble lubricant. Next, we're gonna make sure we have our specimen, or I'm sorry, our speculum, which I see you already checked. Our light source works. I've got my gloves. I've got my cervical broom, my swab, some gauze to put my jelly on. And here's where we really went wrong. I hope we don't have to collect this big of a specimen. Is this the better size? That's great. So we'll get a specimen cup for our thin prep. Okay, Leslie, so usually before I get my patient in position, I like to set up my tray, so we're all ready to go. So I'll put on my gloves, and if you could just put a little lubricating jelly onto that gauze. Okay, and once you have that out, if you can open the specimen cup, so we're all ready to go. And then we'll get our patient in position. Okay, Abby. So first thing we're gonna do is I'm gonna pull out these stirrups. And we're gonna have you put your feet into the stirrups. So I'll help you guide you up here. So 1 foot here, and then 1 foot here. Okay? And then if you can slide down until your bottom is at the end of the table, and you don't want to feel like you're gonna fall off. And then try to lay back and just be comfortable. Okay? All right, I'm gonna take a look. Okay, Abby, so first we're gonna get your drape set up here. And I wanna make sure to push the drape down in the middle so I can see your face. Okay, so first you're gonna feel my hand touching you, and I'm gonna work my way down. Now, I'm gonna take a quick look at the outside of your vulva, your labia minora, and your labia majora. Okay, now sit tight. I'm gonna prepare my speculum. So I'll take the speculum in the left hand and hold it so that it stays shut. I'm gonna wanna put a little bit of lubricant on all surfaces of the speculum. Then I'll turn my light on, or have my assistant turn my light on, and we'll work our way over. You'll feel my hand again. And then with my right hand, I'm just going to separate the labia majora. And then I want to introduce the speculum in an oblique fashion. And you're going to feel a little pressure here. So I want to keep the speculum with posterior pressure and then introduce until I feel a little bit of resistance where hopefully I'm at the cervix. Okay, Abby, you're going to hear a click now when I open the speculum. And then we can see our cervix here at the end of our speculum is well visualized. So then I can ask my assistant to hand me the broom. And if I keep some pressure with my right hand on the speculum, I'll use my left hand to get the broom directly into the cervical os and then sweep back and forth so we make sure to cover the squamo-columnar epithelium. So we'll hand this to our assistant, who will put it in the thin prep. And then if we need to take a look at all, we'll look around if we see any abnormalities on the vaginal wall. Okay, Abby, one more click. We'll close the speculum, keep some posterior pressure, and turn again to the side as we withdraw. So Leslie, one thing you did right today with the setup was to include this swab. We didn't need it for this patient, but sometimes we'll use this if there's discharge on the cervix to clean the area before we use the cervical broom. Okay, Leslie, so now all we need to do is the bimanual exam. Abby, I'm gonna go ahead and do an internal exam. So you're gonna feel my hands a little lower here. So what you'll do, Leslie, is you'll put two fingers, again, posterior pressure, facing down. The appropriate hand position for this is to tuck your fingers like this. So some posterior pressure, and you want to expose the abdomen a little bit. Posterior pressure until you feel the cervix.
It should feel like the tip of your nose.
And then you'll go ahead and push from just below the umbilicus to the symphysis pubis and try to push the cervix again so you can feel the uterus. And then you go to the right, working your way down to feel the ovary, and then to the left, working your way down to feel the ovary. Okay, Abby, we're all done for today. You did great.
Thank you for being professional and treating me with dignity and respect.
Well, Leslie, we had a big day today. And when I look back, there's a few things I'd like you to remember. So first of all, make sure that your patient is appropriately draped at all times to maintain their dignity and privacy. For each part of the exam that you do, be sure to explain it to the patient prior to performing it. Before beginning the exam, be sure that you set up appropriately with all the supplies you'll need. And finally, remember, when you're more comfortable, they're more comfortable.
Oh, you can see they had a good time doing that. But yeah, I just want you guys to see that just a general idea of what's happening whenever whenever they are doing a vaginal exam. I'm sure that all of us at one time or another have had to have one, but it's a different thing seeing it from the other side, right? I didn't know all that stuff went on. I'd just be trying to wish they'd hurry up and get it over with, you know? So here in this next video, it's going to show you a step-by-step procedure for preparing for a pap smear. Now, when you get to your doctor's office, they might want some different things set up. If you have, if they're doing a pap smear procedure, it might not be exactly like this, but I did want you guys to get the general idea of the pap smear and the step-by-step, the medical assistant end of pap smear preparation. The original video, the first video, was just to show you just the process of doing a pap smear and what the doctor would do, or the nurse practitioner or whoever is doing the examination. And now this one is to show you how you would assist the doctor to do that procedure. So pay attention to that. See if I can get some volume.
Foremost, you want to make sure that the patient did verify that their name is correct along with their date of birth. Make sure they initial every single label. This here is the thin prep, which holds the specimen that was collected from the ECC, which is cervix. Both of these swabs here can be used to collect a gonorrhea and chlamydia specimen. This one can be used as a vaginal cell swab and also be done when the provider is doing the annual exam. This one can also be used vaginally, but not via cell swab. It can, however, collect the rectal and the throat gonorrhea chlamydia swab. If your provider is doing a pap smear as well as a gonorrhea chlamydia swab, both tests can be done off of the thin prep. Thus, you do not need to do this one as well. The first swab that will be used will be this one here. After the provider has collected the specimen, that will go to the medical assistant. The second item used to collect the specimen looks like a paddle. After both specimens have been completed, you will take the paddle brush, which also has cells collected by the physician, and use this end to scrape off the cells off the other brush. Again, you want to do this while the specimen is in liquid, which is in the line. After that has been completed, you want to make sure your label is on here with your patient initials, and you will write E, PCT. For an added safety measure, please verbally verify the patient's first and last name before placing the specimen in the lab bag with the requisition.
Okay,
These
there's that one. And then I did have one more. And I wanted to talk to you about whenever you have a patient and you are doing an exam, there are certain positions. Uh-oh. Somebody else waiting. Oh, that's the chat. It's okay. There are certain positions that you need to make sure that having the patient put in. And so let's talk about this one first. I don't know how familiar you guys are with anatomical directional terms. Anatomical directional terms. This is going to go over those a little
Directional
bit.
language of anatomy exists in order to directional terms. A directional language of anatomy exists in order to minimize confusion when discussing areas or specific points on the body. This directional language or terminology is used in reference to the anatomical position. The anatomical position is when a person stands erect, face pointing forward, arms at the sides, palms facing forward, and feet also pointing forward. If everyone is looking at the body in the exact same position, there will be less confusion when discussing anything related to anatomy. We're going to start with superior and inferior.
So this is the anatomical position. This is across the board medically. Whenever they refer to a patient or refer to anything on a patient, they're always starting from this anatomical position. So it's never a patient that's reversed or anything like that. It's always referring, this is the starting point for identifying any part or any issue or whatever it is regarding a patient, okay?
When discussing anything related to anatomy. We're going to start with superior and inferior. Superior means toward the head, but it can also mean upper or above. Inferior means toward the feet, but it can also mean lower or below. So we would say that the heart is located superior to the small intestine, or we could say the small intestine is located inferior to the heart. Next is anterior and posterior. Anterior means further to the front or in front of. Posterior means further to the back or in back of. So we would say the sternum is anterior to the heart and the heart is posterior to the sternum. Sometimes the terms ventral and dorsal are used in place of anterior and posterior, where ventral means anterior and dorsal means posterior. Anterior and posterior can also be used to describe how you're looking at the body. While the body will always be referenced from the anatomical position, it can be viewed from an anterior view, meaning looking at the body from the front, and it can also be viewed from the posterior view, meaning looking at it from the back. Medial and lateral are another set of directional terms. Medial means toward the midline of the body, and lateral means toward the side of the body, or away from the midline of the body, where the midline is an imaginary line that divides the body into left and right halves. So we would say that the heart lies medial to the lungs, or you could say that the lungs lie lateral to the heart. Lateral can also be used to describe how you're looking at the body. While the body will always be referenced from the anatomical position, it can be viewed from the lateral view, meaning looking at the body from the side. Next is proximal and distal. Proximal and distal are terms that are usually used when describing parts of the appendicular body. Remember that the axial body consists of the head, neck, and trunk, and the appendicular body consists of the limbs or appendages that are added to the axial body. Proximal means closer to the axial body or toward the trunk of the body, and distal means further from the axial body or further from the trunk of the body. So we would say the thigh is proximal to the foot, or you could say the foot is distal to the thigh. Superficial and deep are another set of directional terms. Superficial means closer to the surface of the body, and deep means further away from the surface of the body. So we would say the sternum is superficial to the lungs, or the lungs are deep to the sternum. Remember, this is the case when we're looking at the body from the front or anterior view, when it's in the anatomical position. And that be the anatomical directional terms.
All right. That's very important for you guys to remember. Very important. You're going to use that throughout your career. So it's very important that you remember those anatomical terms. And if you want to go into if you want to go into YouTube or whatever it is that you want to do, you definitely need to remember those anatomical terms. Okay? All righty. And then we have one more video. And this one is talking about positioning a patient. This one is not, they don't have an audio to it, so I'll kind of talk you through it. Okay, so these are different positions that you want to put a patient in for an examination. So this horizontal recumbent position is used to examine the breast, the abdomen, the organs, hemorrhoids. The patient is lying flat. I'm slow. Patient is lying flat on their back with their legs together, their hands at the side of their body. So whenever you have a patient, generally, an initial assessment, patient is going to start off in this position. Okay. The dorsal recumbent is used for the digital, vaginal, or rectal exam. The gown is opened in the front. Both feet should be flat on the table, and their knees should be flexed. Okay. And they also do this a lot of times, like if they're doing breast examinations or whatever, abdominal exams or vaginal. Like I said, if they don't do a different position for that, it's the dorsal recumbent position. Semi-Fowlers, you're going to see a lot of that. That's a general hospital position. This is used with respiratory and patients with respiratory and cardiovascular problems. And the reason that they're sitting at this, their head is at a elevated to a 45-degree angle. And the reason that they're sitting in this position is because it helps them with their breathing. It's also a more comfortable position than just laying flat on the back. So a lot of times you'll see patients who are sitting in a semi-Fowler's position. All right, that's a semi-Fowler's position. All right, this is the high Fowler's position. This is mostly used for patients who are going through respiratory treatment or patients who are having cardiovascular issues, heart issues, or cardiovascular issues. Of course, respiratory issues are issues with their lungs or their breathing. This is a patient who's sitting straight up. Their head is raised. They are at a 90-degree angle, and their knees are elevated in a sense. I don't know. This is a high Fowler's position. So if they're sitting straight up, like they're sitting in a chair almost, this is high Fowler's. Okay, sometimes patients who are in extreme respiratory distress, they're having a very hard time breathing. They have to be in this position. So like maybe a patient who is a COPD patient, if they're going through a bad time, they might not be able to do the semi-Fowler's that's down here. They might actually need to be in this high Fowler's position. Also, patients who have cystic fibrosis, where they produce a lot of mucus in their lungs that they have to cough up. So they might be in that type of position as well. This is the prone position. In this position, the patient is laying on their stomach. This is generally a position used for examination of the spine and back. They're on their stomach, their head is to one side, their hands are underneath their head, and the gown is open in the back. This is the prone position. Anybody can think of an examination or a procedure A type of doctor that generally has their patient in this type of position? Anybody?
I don't know. Someone who does a BBL.
A BBL?
What was the question?
What is it? What type of, have you ever, anybody know of a type of doctor that would have their patient in this position normally?
A
If
chiropractor.
they're getting
Yeah.
a bone marrow.
Oh, it's possible with bone marrow. Yeah, I guess so, huh? But definitely
Yeah.
a chiropractor would have their patient in this type of position. Or massage therapist is going to have their patient in this type of position. Okay, or even sometimes the allergists will put their patients in this position when they're going to put those tests on their back, the swabs or the cultures on their back to see which they react to. Okay, so this is that dreaded lithotomy position. This is the one that we hate so much. Right, Alicia? We don't like this one. This is where patients do pap smears. They're generally on their back, their legs are flexed, and maybe on stirrups, flexed on their abdomen, their feet are in stirrups, their thighs are apart, and their gown is open in the back. It just depends on the doctor. Sometimes they do have it open in the front so they can do a breast exam as well, but generally it's open in the back in this lithotomy position. Of course, their feet are going to be in the stirrups, and their bottom is actually going to be toward the end of this bed here, examination table. Okay. And then the next one is the Sims position. This is examination or treatment position. Sims is examination or treatment of the rectal area and for patients who are receiving enemas. Do y'all even know what an enema is? I don't know. An enema is a procedure that is done where a patient has basically a cleansing of their colon, where fluid is injected into the colon to help to loosen the stool and cause it to come out. If you never heard of an enema before, but that's what it is. This one, if their patient is turned on their left side, their right leg is drawn up high and forward, their left arm is along their back and chest forward. Their gown, of course, is open in the back so that the doctor or whoever's doing the procedure can access them. Okay. This is the knee, chest, or genupectoral position. It's for rectal exams, proctological exams, and occasionally a sigmoidoscopy also. A proctological exam is an exam that's done on a man where the doctor is checking his prostate. I don't know if we talked about urinary system. You know that men have their prostate gland actually surrounds their urethra. So it's on the inside of the body and it surrounds the opening that leads from the bladder to the outside of the body. On a prostate exam, doctors generally have to do that rectally to check their prostate. Although they are coming up with a lot of different procedures now, blood work even, that they say has better results than doing the regular prostate exam. But at least you'll know what they're talking about when they say the knee, chest, or the genupectoral position. Their hands are folded under their head, their chest is down to the table, knees separated, gown open in the back for that one. Oh, I'm sorry. This one here. Oh, don't do that. This thing. It's just going to not be right. This one here is the Trendelenburg position. Let me see if I can get to it without that thing in the way. Nope. Okay. The Trendelenburg position is actually used for patients who are called what's called syncopal. Or have syncope. Syncope is just a fancy way of saying that they feel faint. So with the Trendelenburg position, the patient's feet are going to be all the way, their feet are going to be up in the air, and their head, they're going to be laying flat on their back with their feet up in the air and their head down lower below the level of the heart. And the idea of this is to prevent the patient from passing out by increasing the amount of blood that's flowing to the brain. Okay? And a lot of the hospitals, like hospital beds that are in emergency rooms and things like that, these are, they are specially designed to do Trendelenburg position. In fact, when you guys come for labs tomorrow, I think we're probably gonna go through some of these positions. We're gonna try them and see. I don't know if my hospital beds work, but it's worth a try, right? And let's see. That is. Yeah, that's it. So, I just wanted you guys to get a kind of a general idea of some of those things. Did anybody have any questions, comments, or concerns? No? Any questions, comments, or concerns? All right. Wasn't that lovely to have with your dinner? Denise is like, I don't care. You are real healthcare.
I have a question, but it's not about the video.
Okay, what's up?
So, me and my sister share the workbook. Now, I have a question because I write in the workbook like we both do.
Mm-hmm.
Does it matter if I take a picture of it and send it to you? Do I have to write it separately, or does it matter?
Yeah, I can't give y'all the same grade.
Huh?
Yeah, we got to try to figure out a way to do it separately. I know it's a lot of questions and whatever to write out. That's why I was saying that, you know, if you could bring the book in, then we can make copies. You know what I'm saying?
Yeah, but so what I do now too, because I mean, I wrote my answers in the book.
Yeah.
And she did too. So, I mean, because she did hers and I went over it to see if it was correct, basically. I'm not gonna lie. But, I'm being honest. So, do you just want me to write on a separate piece of paper?
Just send it to me. Just send it to me. And we'll work it out next time.
Okay.
Okay. All right. So that's it for me, unless you guys had any other questions. Everybody's cool on the homework. You know what you need to do? I need that typing test done.
The first 3 pages.
Yeah, the first 3 pages. 6. What's that? I don't know why y'all be asking me. Then y'all text me in the middle of the night like I'm a no.
Okay.
I don't know. 6,
Good night.
15, and 16. 3 pages.
Can I turn before 12?
What is that, Mikhail?
This is me.
And what are they do?
Like,
You went away.
hello?
You went
Hello?
away.
Can you hear me now?
I can.
The workbook pages before 12 that
Yeah.
we discussed?
Yeah.
Okay.
Absolutely. Absolutely.
Okay, thank you.
All right. So I think everybody.
I'm loving the purple, by the way.
Thank you, girl.
You're welcome. I'm loving it.
All right. Yeah, I had to. Yeah, I don't know. Y'all know me. I'm sure by now. My hair don't stay the same at all. Miss Star was talking about. I didn't even recognize you today, so I don't know. But it is what it is. Okay. So if we don't have any other questions, and you guys please make sure Homework is due by Friday. I will also be sending out a copy of your week 2 exam. Is going to be sent out in the morning. In the morning. I need that exam back to me by Wednesday. Woo. I'm sorry, what's today? Yeah, today's Monday. Tuesday. So I'll be sending it out Tuesday morning, and I need it back to me by Wednesday. Wednesday. All right, as soon as possible, so we can get your grades going. All right? And
Girl,
the work is due for Friday.
sit down. Okay.
All right, so if you guys don't have any other questions, comments, please keep in mind those things that we just talked about. We will be going over some things when we get in the lab. Just be mindful of that. If you have any other issues, questions, or concerns, y'all know that I'm pretty much on my phone all the time, so hey. I'm gonna text you back at 2 o'clock in the morning when I wake up. Whatever. All right, I'll see y'all later. See you tomorrow. I'll see
All
you
right.
tomorrow. Bye-bye.
Bye.
Bye-bye.
Can we take off this necklace?
You shouldn't have put it on.
You doing okay, Cassandra? Oh, Mikael has your Kindle. How are you doing your work?
Oh, I know. I was writing to her right now. They gave me another one.
Oh, did they? Oh, okay.
So I'm gonna just give her that one back.
Okay.
I'm the only one on here.
Yo, some other people are still hanging on. I don't know.
Okay. Bye.
All right. Alexandria, you okay? Jamelia, you all right? What's up? Where you been, girl? Jamelia. Hello. Oh gosh. Are you still there? Hello? My goodness. All right. I'm going. Okay. See you later.